Good morning, everyone. Thank you so much for joining this very urgent and important press conference. We are very pleased to be on and sharing this space with so many reproductive leaders and providers in our work. And you'll hear some important messages for them. For all media and supporters on this call, please know that we are going to start off with remarks from each speaker. And then from there, we will turn it over for Q&A. And to ask your questions, just simply raise your hand and we will take you off mute and we will go from there. So without further ado, I do want to kick it off to the president and CEO of Planned Parenthood Southeast, Carol McDonald.
Good morning, everyone. My name is Carol McDonald. I use they, them pronouns, and I am the president and CEO of Planned Parenthood Southeast and Planned Parenthood Action, the Planned Parenthood Southeast Action. This is, it's been 2 years since the United States Supreme Court ruled in Dobbs v. Whole Women's Health, and in effect, the ending an almost 50-year history of having protections for abortion rights in the highest court of the land. Since then, what we have seen here in the Southeast has just been devastating. Our organization, Planned Parenthood Southeast, serves 12,000 patients in Mississippi, Alabama, and Georgia. And those 3 states have been some of the hardest hit states when it comes to state-based abortion bans that the court then allowed 2 years ago. What we have seen in the last 2 years has just been devastating. In Georgia, we have an abortion ban that starts at the onset of what we call fetal cardiac activity, generally around 6 weeks in pregnancy, which means that this is at a time abortion is banned before many people even know that they're pregnant. In Alabama, abortion is banned outright, as it is in Mississippi. What that means is that people don't have access to healthcare. And we have come together as a community today. You'll see speakers not just from Planned Parenthood, but from our other providers and advocates in the region. And we are coming together collectively to call this an urgent SOS, state of emergency in the Southeast. Now, I can very specifically speak about the 3 states where we provide services, but Planned Parenthood Southeast is part of, we're part of the South, and the South makes up, all of the South is included in the 21 states that have severely restricted access to abortion. I'm going to make sure that our providers on this call are able to speak to what that means for our patients. But what we know for sure is that these attacks, these restrictions on abortion are politically motivated. They are strategic and intentional. And their impact is devastating on our bodies and our lives. It means that we cannot seek healthcare in many of in any circumstances, and it also has a larger ripple effect in the healthcare landscape. And when I think about these abortion bans, I think about the challenges that we are having with recruiting physicians and clinicians to come work in these states. I think about the recent news out of Alabama that shows that applicants for residency, for medical residency in the state of Alabama are down by 20%. 20%, which means that people who are trained to be doctors don't want to come to states that have abortion bans. And I know that my sister Pamela Merritt is going to speak on that as well. I think about the report from Forbes magazine that came out just a few months ago that listed the best and worst places to get healthcare. And the first 7 states, the 7 worst states to get healthcare are all in the South. Georgia is number 1, Alabama is number 2, And just when, and we're looking at Mississippi, because sometimes we think Mississippi is in that list. Well, Mississippi is fourth. So we are looking at providing sexual and reproductive health care in an environment where healthcare has already been a crisis. So we are joining together today. We are calling on our leaders and telling them that it has been 2 years. This is 2 years too long. These are having devastating impacts on our communities and on our people. It is a state of emergency for sexual and reproductive health care, for sure, in the Southeast. And while we dig into the details on how that impacts our folks, I do want to say that the reason why you see all of us together today is because we are resilient, we are united, we are going to continue to fight this, but we need everyone's support. We know that these abortion bans are, by and large, completely unpopular with everyday people, with our residents and our voters. And we have seen that anytime this issue has been on the ballot in the last 2 years, abortion bans have been soundly defeated, and access to sexual and reproductive health care has been uplifted because people understand the connection that what this means in their lives. So I want to thank our partners that are here with us today. And I now want to kick it over to my dear friend and partner in the movement, Kwajelyn Jackson from Feminist Women's Health Center, to speak even more about what this means as a provider. Thank you.
Thank you so much, Carol. My name is Kwajelyn Jackson, and I'm the Executive Director of Feminist Women's Health Center, which is a reproductive health, rights, and justice organization that has been compassionately providing abortion care since 1976 and continues to provide abortion care in spite of the ways that our laws have tried to extinguish that care across the country. Know that in the past 2 years, this state of affairs has been devastating to our communities. No matter how many times we have to go through it, it never gets less heartbreaking to turn someone away from care that they so desperately want and need. The people who have to relive their trauma, the people who have to compromise their health, the people who have to sacrifice so many things within their everyday lives in order to get care that they should be able to have where they live. But the things that I want you to know about what we have learned over these 2 years are, one, that we are still having abortions in spite of draconian laws that would totally ban abortion care or restrict it to the point where it's almost non-existent. People continue to visit clinics like Feminist Women's Health Center, like Carafem, like Planned Parenthood Southeast, like clinics all around the country. People continue to seek care through telemedicine providers that can help them to get access where they are. People continue to use medication abortion to manage their abortion care in the ways that work for them with the people who love them. We will not allow unjust laws to prevent us from controlling our destiny. Second, I want people to know that clinics and funds still need your support. We have seen an outpouring of care and support and resources in the immediate time after the Dobbs decision. But over time, that has waned. And not because people don't care, but because there are so many things that are calling for our attention. So we would ask you today to not forget that abortion providers, abortion funds, reproductive justice organizations are still in the trenches. We are still making a way out of no way, and we need you to link arms with us. We need you to dig into your pocketbooks. We need you to volunteer. We need you to tell a friend. We cannot allow the South to be abandoned in this moment. We cannot allow places like Georgia, Mississippi, and Alabama wither on the vine. We need to make sure that the places where the work is the rockiest, we put the most investment. And then the last thing I want to leave people with today is that in spite of all the evidence to the contrary, we are not powerless in this moment. Things are difficult and they are subject to worsen over the next several years. But that does not prevent us from digging in, from doing more, from connecting with our community, from partnering with one another. We know that it is critical for our liberation, domestically and globally, for us to have full bodily autonomy, full stop. And so I want to encourage people who feel defeated to remain undaunted in this moment. We are 2 years into a terrible reality, but it is not the end of the story. So I am deeply committed to making sure that abortion is restored in the United States of America in my lifetime. And I will do nothing that allows me to be deterred or daunted in that fight. And I hope that you will join us. Now it's my great honor to pass the microphone to Pamela Merritt.
Thank you so much, Kwajelyn. It's a pleasure to be here, even under such dire circumstances, with such amazing and esteemed colleagues. My name is Pamela Merritt. My pronouns are she, her, and y'all, and I am the Executive Director of Medical Students for Choice. Medical Students for Choice is in our 31st year of providing abortion training and education to any medical student who seeks it through our interface. We started off founded by medical students in the United States. We now have chapters at medical schools in 30 countries. And obviously our largest membership is in the US, but our fastest growing membership is in the Global South, where activists are problem solving many of the same barriers to abortion care and reproductive health that we see in Mississippi, in Georgia, and in Alabama. We provide abortion training and education to medical students and residents by connecting them with opportunities to train in an actual abortion provider in a clinic. We also provide abortion training institutes that provide care on medical apparatus and allow for our members to interface with providers. But one of the most important things that we do is support chapters at medical schools all over the country. We have 4 chapters in Georgia. We have 2 chapters in Alabama. We have 2 chapters in Mississippi. And when I tell you that we are in the midst of an ongoing, fast-moving, man-made disaster to medical education, I am telling you the truth. Significant declines in medical students applying to residency programs means that the most integral way that hospitals are able to provide care to communities is significantly declining. Hospitals depend on residents to help them provide care, particularly in under-resourced hospitals. So the poorer a community, the more under-resourced it is, the more it needs residents, the more it needs quality, talented, trained providers of reproductive health care. This is more than just a crisis in OB-GYN training and education. This is a crisis across the board. I cannot express more importantly that we are seeing significant declines in people applying to residency programs across all specialties. Podiatrists don't want to practice in states with abortion bans. And that's because they are people too. And that is also because most of these states have shown a willingness to arbitrarily change the standard of care on multiple practices. When you see the attacks on gender-affirming care coupled with the attacks on reproductive health care. Not only are they all of the same attacks on bodily autonomy, but they all send a message. Medical students and residents watch the news. Medical students and residents research their future choices in their career. And medical students and residents have made tremendous sacrifices and dedicated years to learning and training so that they can be the best doctors they can be and center their patients' care. They cannot receive that education and training in states that have regressed and no longer allow for them to learn modern and effective medical practice. The impact is something we don't have to speculate on. As the executive director of a global nonprofit, I can assure you that when abortion restrictions are put in place, public health outcomes come soon after. The reason why the fastest growing membership to Medical Students for Choice is in the Global South is because nothing demonstrates the need for access to reproductive health care and trained providers like the absence of access to reproductive health care and trained providers. Our chapter leaders and student leaders in the Global South know what we are learning painfully all over again in this country, which is that we need to liberate healthcare from bureaucracy and from politics. Doctors need to be trained and doctors need to be able to assess their patients without a legislator who has an ambition and more ambition than common sense in between them in that relationship. So this is a public health emergency. This is an emergency for pregnancy outcomes and those who are seeking care for pregnancy, whether it is to take a pregnancy to term or to have an abortion. And this is a crisis that will impact access to reproductive health care and impact access to all health care sooner rather than later. If you're banking on the fact that you have nationally recognized programs like Emory or like Morehouse Medical School to get people recruited into your state, let me assure you that medical students are doing deep research. They know where they can and where they cannot receive training. And the other thing is that those rankings aren't set in stone. Those rankings are based upon the ability of these medical schools to provide top-notch competitive education. And right now, abortion bans are limiting it to the point where our members aren't even hearing the word abortion or family planning in their med school halls. They know it, people applying know it. This is a crisis in medical education. And finally, I'll say that this is truly a state of emergency. When we don't have healthy communities, then every bit of every platform for progressive health and growth is impacted. People can't provide for their families. People can't interact within their communities if they're not healthy. So this is a state of emergency in healthcare. It is a state of emergency in medical education. I'm calling the alarm because these abortion bans and their long-term impact are a direct threat to the profession of medicine, to the ability for people to envision themselves providing care under arbitrary limitations, not based in science, but based in ambition and cruelty. We need doctors. We need them to be unrestrained, to be bold and audacious, particularly in states with really indefensible public health outcomes that were just making strides to impact those when the Dobbs decision came down. And with that, it is my pleasure to hand this over to Danielle Rodriguez of SisterSong.
Thank you so much, Pamela. Good morning, everyone, and thank you for joining us today. My name is Danielle Rodriguez. I use she, they pronouns, and I'm the Georgia Program Coordinator of SisterSong, the National Women of Color Reproductive Justice Collective. We are an organization rooted in the belief that reproductive justice is a fundamental human right. 2 years ago, a seismic shift occurred in the landscape of reproductive health care in the country. Yet community organizations like SisterSong have long recognized that Roe v. Wade was never a cure-all. It was a necessary step, but it allows states to impose laws that control our lives, erode our freedoms, undermine our rights, and jeopardize our future. Roe was a beginning, not an end. We must envision a future where our solution transcends merely restoring Roe v. Wade. We must strive for a vision where our boldness knows no bounds. This means advocating for comprehensive reproductive justice that not only includes the right to choose, but also ensures access to quality health care, education, and support systems. It means challenging and dismantling the systemic barriers that have long oppressed marginalized communities. Our boldness requires us to imagine and fight for a world where every person has the autonomy to make a decision about their own bodies, free from political interference and social stigma. The struggle for reproductive justice is interconnected with the fight against systemic oppression in all its forms. We recognize that reproductive freedom cannot be achieved without also addressing the broader issues of state violence, environmental degradation, and economic injustice. In this vision, we see a Georgia where reproductive freedom is not just a right, but a reality for all, where politicians cannot play games with our lives and futures, and where our communities are empowered to live with dignity, health, and freedom. This is the future we must boldly create together. While sharing personal stories from my community feels invasive at this time, the choice to have an abortion or not is deeply personal and should remain free from state and media intrusion. However, it is essential to highlight the real and often heartbreaking impact these restrictive laws have on individuals. Take, for example, a young woman in rural Georgia who discovered she was pregnant just a few weeks after the near total abortion ban was enacted. With the near clinics over 100 miles away and a mandatory waiting period in place, she faced immeasurable logistics and financial barriers. Her story is not just one woman's struggle, but also the systemic inequities that many face daily. The stories are deeply personal and highlight the urgent need for systemic change. They remind us that behind every statistic, there are real people facing real struggles. The decision to have an abortion is a private matter and should not be subjected to the whims of political agendas. Each story reflects the broader issues of access, equity, and the right to make autonomous decisions about one's body. In the spirit of Octavia Butler's wisdom, all that you touch, you change. All that you change changes you. The only lasting truth is change, and God is change. These personal narratives emphasize the transformative power of our collective action. By sharing and listening to these stories, we can drive the change needed to create a future where reproductive rights are respected and protected for all. To address this crisis and forge a future where reproductive freedom is unequivocally guaranteed, we champion the Reproductive Freedom Act. This transformative legislation enshrines essential protections for reproductive freedom into Georgia law. It asserts that every individual who becomes pregnant has the right to choose to continue their pregnancy or to have an abortion. We call on policymakers, healthcare providers, and community leaders to unite in support of the Reproductive Freedom Act. This act is a pivotal step towards comprehensive reproductive health care for all Georgians. We also call on you, our supporters, to stand with us, share your stories, spread the word, and support organizations like ours on the front lines of this struggle. It is an honor to pass the mic to Dr. Megan Cohen.
Thank you so much. Good morning, everyone. I'm Dr. Megan Cohen. I'm a board-certified OBGYN, a complex family planning specialist, a proud abortion provider here in Georgia, and medical director of Planned Parenthood Southeast, covering Georgia, Alabama, and Mississippi. Today, we gather on the ominous anniversary of the Dobbs decision, 2 years too long that we have had our fundamental reproductive rights stripped away. Overturning Roe v. Wade, Dobbs allowed for nefarious laws to crop up across the country, making it a crime for healthcare providers like me to provide the routine, evidence-based reproductive healthcare my patients need. Because that's what abortion is. It's routine reproductive healthcare. The US has the worst maternal mortality of industrialized countries. And here in the South, we are at the epicenter of the maternal mortality crisis. Even before the Dobbs decision, states with more restrictive abortion laws had greater maternal mortality. And Black women and birthing people have 3 times the risk of dying in childbirth as white women. Abortion restrictions only serve to make this worse. Abortion at any time in pregnancy is incredibly safe. It is 14 to 100 times safer than childbirth in the United States. In fact, we know that abortion restrictions only serve to make abortion less safe, and they do not decrease rates of abortion. And that is true globally as well. As Carol said, here in Georgia, we have a ban on abortion with very few exceptions after detection of cardiac activity. This typically occurs around 6 weeks of gestational age, which is only 2 weeks after a person who has regular menstrual cycles may see a missed period. And it's before many people even realize they are pregnant. At this very early stage of pregnancy, it is not always even possible to distinguish between an early normal pregnancy versus an ectopic pregnancy, which is a pregnancy growing outside the uterus and can be a life-threatening condition. And while many of our colleagues around the country think that this means that we're not providing abortion care, they could not be more wrong. Our patients are so resilient, and they have been able to detect their pregnancies at such early stages and present to us for abortion care. Here in Georgia, we also have both patients coming from other states desperately in need of abortion care that is completely banned in their home states, and patients that we have to tell the devastating news that they need to travel to find care outside of our state because our draconian laws prevent them from getting the abortion care they need. I've seen patients from as far as Texas, Louisiana, Tennessee, and Mississippi all come here to see us in Georgia. It is heartbreaking and demoralizing, though, to have to turn away patients just because cardiac activity was detected, or because they are not yet sick enough, or because they did not report a rape to law enforcement, and therefore they are ineligible to have an abortion under the laws in Georgia. I will never forget having to tell a patient who was sitting in our clinic that Georgia's abortion ban had suddenly gone back into effect, and I could no longer simply hand her the medication that she needed. It was the day before Thanksgiving in 2022, and Georgia's Supreme Court had unexpectedly and immediately reinstated the Georgia draconian ban. She was just a few days too far along in her pregnancy, and it was horrible to sit in front of this patient, and tell her that I could not provide the healthcare she needed because of a decision made by politicians about her body. She was in tears and I was in tears. It was devastating. And it violated and continues to violate the most deeply held principle of being a physician. First, do no harm to your patient. These radical abortion restrictions are doing harm to our patients. They are leading to delays in care, including obstruction to management of miscarriage or early pregnancy loss, in diagnosis of ectopic pregnancy, or delays in managing infection or hemorrhage, resulting in potentially catastrophic pregnancy outcomes, including maternal mortality. I have personally seen multiple patients denied treatment for presumed ectopic pregnancy due to confusion and fear created by the law. And as we said, everyone has deeply held personal reasons for seeking an abortion, and there is no reason that this should be limited by politicians. However, I want to make one thing very, very clear. Roe was always the floor and not the ceiling. Even with Roe in place, access to abortion care varied. Roe never ensured that people could actually get an abortion. And this disproportionately affected Black, Indigenous, Latina, trans, and non-binary folks, and people with low income. And these are the same marginalized communities that are most impacted by the abortion restrictions today. And these are the communities that we need to elevate the most. So I would like to call on everyone to continue in this fight to help us undo these radical abortion restrictions and to allow for personal autonomy and freedom of choice, and to stop interfering in the relationship between the physician and the person making these decisions who know what is most important to them in these times. And with that, I will pass this over. I have the honor of passing over to Stephen Stetson, our Alabama State Director. Thank you.
Thanks, Dr. Cohen. Good morning. Thanks to all for being here. I'm Stephen Stetson. I'm the state director for PPSE in Alabama. I'm based in Montgomery. I use he, him pronouns. Alabama's ban is one of the most restrictive and punitive in the nation, with no exemptions for incest or sexual assault. The one exemption we do have for life-threatening medical necessity is always difficult, sometimes impossible to access due to physician shortages and complexities and time-consuming nature of reaching consensus on just how close to death the person is. So our law has created some perverse incentives that contravene the basic precepts of life-saving medicine. This is not happening in a silo. People are fleeing the state to receive healthcare in jurisdictions where it isn't illegal, and countless others simply can't make the trip. People have jobs that tether them close to home, transportation constraints preventing them from long-term interstate travel. It's a classic example of how the ban has a disproportionate effect on low-income Alabamians and people of color, layered on top of the overall abysmal state of healthcare apartheid that has seen rural hospital closures in light of the state's failure to expand Medicaid. Our system in Alabama is broken. These discriminatory healthcare deserts have been exacerbated by the massive 20% drop in OBGYN residency applications here, because would-be doctors don't want to practice medicine in a state where a big chunk of their medical practice is forbidden by state law. This is a healthcare crisis and an economic development one. Nobody wants to go play football for a coach at a state where the forward pass is illegal, and nobody wants to go to med school and practice medicine where the entire chapters of the textbook are off limits due to reactionary state laws. And finally, you can't discuss reproductive health in this nation, much less in Alabama, without talking about in vitro fertilization and the crisis caused by Alabama's Supreme Court decision last February in the LePage case. This made national headlines. And although the legislature scrambled to throw together a piecemeal response, the disaster is far from over as litigation continues and the court's interpretation of our state as a home to a bunch of electrified, frozen embryonic nurseries remains the law of the land. Any efforts to deal with this complex ethical tangle is going to require a legislative repeal of our state's primitive personhood amendment, and then we'll go from there. And this is just a little overview sampling of the crisis in Alabama precipitated by the Dobbs decision and our reckless state leaders. I'll be happy to answer any questions at the appropriate time, but I'll pass it now to Melissa Grant. Thank you so much.
Thank you very much. Hello. My name is Melissa Grant. I am pleased to join my esteemed colleagues here to talk currently about providing abortion care at Carafem. My title is Chief Operating Officer. I use she, her pronouns. Carafem is a nonprofit organization that was co-founded by me in the year 2013. We currently provide in-person abortion care proudly in the state of Georgia, as well as in Chicago and DC metro areas. And I'm providing telehealth abortion to people from 17 states across the United States with a team of passionate physicians, nurse practitioners, nurse midwives, physician's assistants, and many others who are not going to step back from providing this care. I'm here to talk a bit about Georgia, but I will enlighten some of you who may not be aware that we are not alone in this. I am part of a global organization that is working to try to provide abortion care around the world. My parent organization, DKT International, currently provides care in over 20 countries around the world. And I founded Carafem with the notion that it was ridiculous that women in Ethiopia and Mumbai could get an abortion more easily than people in the United States. We are continuing to work to try to put patients first in every situation that we can. I was born in Texas. I was raised in Kansas and in Iowa. People in the Midwest and in the South are suffering the most during this period of time. We need to change this. I can tell you that there have been some highlights that have occurred. The idea that patients are able to find out that they're pregnant earlier does help in a situation where at 6 weeks they are no longer able to be provided care in their own state. But currently Carafem is unfortunately having to turn away as many as 40% of our clients. In addition, our coverage and client care that was exceptional and so badly needed in the state of Tennessee was forced to close completely. This is nothing I thought I would see in my lifetime. I have been working in this field for 35 years. I will say that in the past 2 years, it's important to remember now that women and people who are able to become pregnant in the US have lost abortion access to the tune of 1 in 3 of us. In addition, over 20 million people have lost access in the states that are still provided, but decreased in the ability to provide the care, oftentimes that the providers have known, loved, and professionally offered their entire careers. This is wrong. Right now, we will continue to try to do everything we can at Carafem and with our colleagues across the South and the Midwest, and in fact, across this country, to make sure that clients know that we will put them first in every opportunity we can. We want you to hear that this is between me and you. And we know that 90% of the time, we may be the first person outside of your family and loved ones that you've said the word out loud that you're pregnant. We are sensitive to that. We are a safe place. We will treat that carefully. And honestly, we care, and we care passionately. This situation in our country is unjust, and it's wrong. As we continue to provide care to people around this country, we want you to know that we will continue to do everything we can to make a difference. And our tagline remains, abortion, yeah, we do that, even when it's hard. However, we also know that we need help. So those of you who are listening to this message that want to contribute, please donate to your local abortion care provider, your local abortion fund. If you can't donate, consider volunteering. There are so many opportunities where you can help. And if neither of those seem likely to you, at very least, reach out publicly when you can and let people know that you are a supportive person to those who need abortion care, that you are a safe place, that people can reach out to you. Say the word abortion out loud. Let people know that it's something that's common and needed and desperately needs the respectful and passionate kind of healthcare that we try to provide across this country, and you can be an ally. With that being said, the only way to destigmatize abortion is continue to lift it and to talk about it passionately, compassionately, and openly. I will now pass this message on to the next of our colleagues, Tyler Harden in Mississippi. Thank you for joining me today.
Everyone, my name is Tyler Harden. I use he, her pronouns, and I'm the Mississippi State Director for Planned Parenthood Southeast. As Mississippi goes, so goes the nation. In 2018, legislators, encouraged by former President Trump's promises to pack the courts, passed House Bill 1510, a 15-week abortion ban that will ultimately be challenged by Jackson Women's Health Organization, the state's own abortion clinic. Today, Jays will no longer exist. Asking the Supreme Court to overturn Roe was never intended to protect lives. Anti-abortion rights groups and politicians have been working for decades to control our bodies, lives, and futures. Have our state officials adequately prepared for an additional births per year? The short answer is no. Mississippians deserve lawmakers who care about their health. The hypocrisy of anti-abortion lawmakers celebrating a Dobbs decision but ignoring the closure of rural hospitals is not law. Corporations continue to bombard, especially for smaller and rural families in our state. Healthcare access is critical for prosperity and well-being. Abortion healthcare hierarchy have been able to partner with stigma and shame to prevent access to abortion healthcare. Your race, ethnicity, religion, gender, sexuality, economic status, education level, or even zip code should never determine what healthcare is available to you, including abortion healthcare. Together, we have the strength to win the fight for abortion rights and access. Opponents in sexual and reproductive health are no match for the will of Mississippians, Alabamians, and Georgians. What we do in the next few years to fight back will lay the foundation for one of the fights of our lives. Today, we call for a state of emergency for sexual and reproductive health in the Southeast. Our patients and state residents deserve access to health care. Tomorrow and each day forever, we continue our advocacy. 2 years has been
Thank you so much, Tyler, and to all of our wonderful speakers on today. This is a true state of emergency for all of our work. So thank you for highlighting that today. We do have members online of our media, so we do have a couple of minutes to take questions. If members of the media, if you have questions, please just raise your hand and I will unmute you from there. And when you say your questions, please, if you can mention your outlet. We'll start with you, Valencia.
Hello, everyone. Valencia Jones here with Channel 69 in Atlanta. My question is, what is your game plan going forward for addressing these concerns? What are the next steps in terms of any legislation and your effort to draw attention to these concerns?
So I'm happy to kick us off, if that's okay. So I know for medical students for choice, we are taking the route of asking the accrediting bodies for medical schools and residency programs to be hyper vigilant in making sure that they are connecting their learners with the anticipated core curricula. So when it comes to medical schools, they are accredited through the LCME. Do not ask me to say what that stands for. I always mess it up. But their accrediting body does not mandate that they teach abortion and family planning. So we have a petition in partnership with AMSA to that body, which is the American Medical Student Association, to the accrediting body, asking them to include abortion and family planning in their accrediting standards. For residency programs, they actually have abortion training and education as part of their accreditation for OB-GYN residency programs. And they have affirmed, the ACGME did affirm that would remain the standard going forward. What we don't know is how strict they will be in their enforcement and how transparent they will be about violations. And that is a gray area. I don't know any patient that wants to be caught in that gray area. So our ask to the ACGME is that they be as transparent as possible so that communities and patients and people applying into residency know exactly how compliant those residency programs are. That's not just an issue of adhering to accreditation. That's a life or death public health situation that we're monitoring. And then I'll pass it on to my colleagues.
Yes, I can also jump in, Valencia. Thank you for this question. In 2023, we introduced the Reproductive Freedom Act, and our biggest issue was that we did not get a hearing for it. We will be reintroducing it this coming year. And basically what the Reproductive Freedom Act does is that it enshrines fundamental protections for reproductive freedom into Georgia law. So it affirms that every individual who becomes pregnant has the right to choose to continue the pregnancy or have an abortion. It also repeals medically unnecessary and harmful abortion restrictions that create barriers to care, like abortion bans, biased counseling, and providers being prosecuted for providing abortion care. And then it expands access to abortion care for patients in rural areas. It expanded to folks adding it to their insurance so that it's affordable for folks in our community. And we really do hope that we had a lot of traction these last 2 years. We got majority of the Democratic caucus signatures on this bill. So it really was very popular. Unfortunately, we just did not get a hearing. And that's our goal this year, is to just pull in community and to get a hearing. Thank you.
And I would follow up with that as a community, obviously we support these legislative and policy changes in order to expand access. There are also a number of us who have the political arm in our organizations where we can make sure that we elect the leaders, the political leaders who will support these expansions and these. Well, really, what we're talking about now is the restoration of the access and rights we had before. And certainly, Planned Parenthood Southeast Action has been very active this year across our states. In Georgia, we have endorsed a record number of candidates who support access to abortion in particular. In the primary, during the primary season, we will be continuing to support these candidates in November. And we have even seen in places like Alabama, when their state Supreme Court handed down the ruling on IVF, how immediately in a special election, we were able to elect Marilyn Lance to the Alabama State House, who ran on a platform of support for abortion rights and in vitro fertilization. What we're seeing across the board now, back in the old days before Dobbs, we used to talk about the group of voters as the mushy middle, that people who may who may be wavering on their support for access to abortion. Now, after the Dobbs decision and these states are passing bans, what we see in people's attitudes and voters, now that they have to make a choice, now that the choice has been forced upon them, it is very, very clear. And the vast majority of people are in support of abortion rights. And we will continue to bring those folks into the tent and into the fold and into our movement and channel their anger, their rage, their outrage in advance to advance positive policy change for sexual and reproductive health care.
Thank you so much, Carol. Unless any other panelists have anything on that, we will go to the next question. Thank you, Valencia, for that. Now we would turn it to Sarah of Georgia Public Broadcasting.
Hi, I'm Sarah from GPB News. Stephen talked a little bit about IVF in Alabama, and I was wondering if you all see this as a bigger fight in other states as far as access to reproductive care goes.
I'll kick us off. I mean, what we see with the proponents of abortion bans is that we know that that's not their end game. They're not done with taking away our rights and our access to care. The same folks who are pushing for abortion bans are also coming for access to birth control. They are also coming to, for in vitro fertilization. And oftentimes, these are the same folks that have opposed Medicaid expansion in their states, and there's still a handful of holdout states. Unfortunately, PPSC on our entire territory is made up comprised of states who have fought Medicaid expansion. These are also the same folks who often promote things like restricting access to the ballot box, that are coming after gender affirming care, that are coming for who are gunning for trans folks, and on a variety of issues. So we know that these attacks on abortion are part of a much, much broader agenda from our opponents to really strip people away from their power and autonomy. And so in vitro fertilization is, at least from my perspective, not a place where I expected our opponents to go. And yet here we are. And I feel like we say that often. We say that on a daily basis. We could not have imagined 2 years ago, 5 years ago, 10 years ago, 20 years ago, how far our opponents are willing to take this. And yet here we are. And even, going back to your original question about IVF, while we saw the Alabama state legislature try to scramble to put together a fix in the moment, but we just witnessed the Southern Baptist Convention just last week affirming the same thesis in a religious context and encouraging their supporters to also consider restrictions on IVF. So it will, these issues for us, I mean, I think we all notice these are all connected, and we see the connective tissue, and we don't just see that as advocates. People see that too. Our constituents see that, our residents see that, our voters see that. And I think it is that connection to a broader agenda that is both the most troubling, but also a place where we see the most opportunity for turning this around.
Add, Carol, is that Georgia's 6-week abortion ban also includes language around fetal personhood. And we have yet to see all the implications that that might have on Georgia code. And so I don't want to discount the possibility that further overreach could result from that language being present, especially the way that it is stated in the law, that in every place and the word natural person occurs in Georgia code, that is said to include a fetus or embryo at any stage of development within the uterus. So I think that we need to be very clear that abortion, that the overturning of Roe in particular was not the end game, that there are much further reaching goals of serving capitalism and white supremacy that are at the core of so many of these laws. And so we have to be diligent to look at all of the places where this might touch.
Thank you all so much for that. We have time for one more question if we have one. Any further questions, please use the raise hand feature and we'll make this our last question. Okay, seeing none. Do any of our panelists have any final remarks before I close us out?
The one last thing that I would say, and Kwajelyn, you touched on it in your last comments about this, a lot of this is in service of white supremacy. 57% of Black women now live in a state that has an abortion ban. 57%, which means that 50% of Black communities don't have access to care. And that just provides another layer that I think that we really need to examine. Because these restrictions are not uniformly applied. They harm specific communities in very specific ways. And it is outrageous to sit here in the year of our Lord 2024 and think of something that can be so devastating to the Black community. And it is just, and this is now just the way that it is. So that for me is deeply, deeply troubling. Also deeply, deeply motivating, and it shows exactly what our opponents are up to and what their primary motivation is.
Absolutely. Dr. Cohen, I see you coming off mute. Go ahead.
Well, I just wanted to kind of add to that, Carol. I think, we were in an environment where the white moderate woman could sit back and say, oh, I don't think this is ever going to affect me. And could not be further from the truth. Could not be further from the truth. We've seen that in the IVF rulings. We see that in people coming for contraception. Truly, places are going to try to ban IUDs, emergency contraception, and anyone is on the precipice of having a pregnancy complication where they may need an abortion, where they may need abortion care. This is the same exact procedure, the same exact medication that we would use if you're having a type of pregnancy complication or faced with a really difficult pregnancy decision that we use in any other type of abortion care. So I just want to emphasize for everyone who is out there that this is not something that you can just sit back and say, oh, this is not going to affect me. I don't need to be involved, because it affects everyone. It's going to affect all families, and everyone needs to rise to the occasion, to make a decision, take a side, and to get involved.
Absolutely. This impacts all of us. And that is why you have reproductive leaders and providers on this call on this daunting and grim 2-year anniversary. So 2 years has been too long. We're truly calling for a state of emergency, not with any political agenda, but this is because our healthcare and the healthcare of our patients and the people that we serve. So thank you all so much for joining. For all members of the media online, please look out for a press release coming from us later on this. Thank you so much to our wonderful speakers for taking the time in your busy days to be on this press conference. And you'll be hearing more from us soon. Thank you all.